You've been to doctor after doctor. The tests come back normal, but your body feels anything but normal. And you've quietly started to wonder if you're making it up. What if the headaches, the exhaustion, the brain fog, the digestive problems, what if those aren't separate issues? What if they're one system telling one story? Today, I'm sharing research from Stanford that finally gives language to what so many trauma survivors have been living in their bodies for years. Imagine a woman in her 40s. She's smart, she's capable, she's caring, but she's been to 4 specialists in the last 2 years. She has migraines that won't quit. She can't sleep. Her GI doctor says that her digestion problems are functional. Her psychiatrist manages her anxiety with medication. Her neurologist can't find an explanation for her brain fog. And every test comes back normal. She leaves every appointment with a referral and a quiet shame. She grew up in a home with a lot of unpredictability, a parent who struggled, and emotional chaos that she learned to manage by going quiet inside. What no one ever connected for her was those early experiences may have literally rewired how her nervous system learned to operate. Her body isn't broken. It learned. And it's been running that protective program ever since. Stanford neurologists noticed a pattern. Children were arriving with multiple unexplained symptoms that didn't fit any single diagnosis. So they asked, is there a connection between these clusters of unusual symptoms and adverse childhood experiences, what you may have heard of as the ACEs? So they studied 100 consecutive patients at a pediatric neurology clinic. Those kids were aged 5 to 17. And they narrowed it down to and focused on 17 children who had 4 or more unexplained medical symptoms that lasted at least 3 months. And those symptoms were then mapped across 6 areas of nervous system functioning. Here's what they found. 88% of the children with 4 or more unexplained symptoms had experienced at least one adverse childhood experience, compared to only 33% of other children in the clinic. Every single child in the high symptom group had sleep problems, body pain symptoms, and emotional dysregulation. 100% of them. 94% had executive functioning problems. So they had problems with memory or attention or information processing. 76% had autonomic dysregulation, which would look like dizziness, migraines, heart rhythm issues. And 71% of them had digestive problems. The more ACEs a child had, so the more adverse experiences they had, the more functional areas of their nervous system were affected. And this was a statistically significant correlation, which means that it wasn't something that could be explained by chance. These children had been to an average of 3 to 5 different medical specialists, and many had visited the ER and still had no unifying explanation for what was going on with them. So the researchers proposed that childhood adversity causes the developing nervous system to adapt to chronic threat. The autonomic nervous system, that's the part that runs the body automatically outside of your awareness, becomes dysregulated. And the vagus nerve, which is supposed to be the body's brake on the stress response. So when you get stressed, when your vagus nerve comes on board, it causes your body to slow down, but that becomes less active. The result is a nervous system that is physiologically wired for survival. That same system struggles to regulate sleep, digestion, emotion, attention, and physical sensation. This is ACEs in action. It's not psychology. It's not imagination. It's actual neurobiological adaptation. So if this is true, it explains why you might have sleep problems. Remember, 100% of the high ACE children had sleep problems. So you might find yourself lying awake even when you're exhausted, or awake at 3 a.m. feeling alert for no reason. Or this could explain why you have nightmares or feel unsafe enough to sleep deeply. The nervous system learned nighttime wasn't safe, and it didn't forget. Now let's talk about 100% of those children having emotional dysregulation. That would mean that you go from 0 to 100% overwhelmed without a clear reason. You can find yourself crying unexpectedly in therapy or not feeling anything at all when something big happens. Or you fawn, freeze, or explode and not understand why you can't just calm down. That's not a character flaw. This is a nervous system that never got a reliable co-regulator. Those kids also, 94% of them had executive dysfunction, which that could explain why you lose your words mid-sentence, or you forget what you walked into a room for, or you struggle to finish tasks. It could explain why you feel stupid in situations where you know you're not. This is cortical inhibition from chronic stress. HeartMath research confirms that stress literally impairs our higher brain function. A dysregulated nervous system cannot allocate full resources to thinking because it's still scanning for threat. And then remember those kids, 76% of them had autonomic dysregulation. That means that you could have chronic migraines, episodes of dizziness, heart palpitations, or feel faint under stress. You might feel wired and tired all at the same time because you're in sympathetic overdrive with parasympathetic collapse. The vagus nerve, the key to calming the body, has been suppressed by years of chronic stress and activation. Think about digestive problems for those kids. 71% of them had it. So you might have irritable bowel syndrome or nausea or reflux, constipation or stomach pain that appears and disappears mysteriously. You might notice that your gut knows when you're stressed before your mind does. The enteric nervous system, which is your gut, is directly connected to the autonomic nervous system. So when one is dysregulated, the other one follows. You might notice like 100% of those kids, body pain. We call that somatization. That might explain why you carry unexplained tension, headaches, or physical symptoms that the doctors can't find a cause for. It could explain why you've been told it's stress in a way that felt dismissive. But the research says, yes, it is stress. Physiological, measurable, real stress. System dysregulation. So when you find yourself in freeze or shutdown, we call that vagal collapse or a dorsal vagal response. And that's when your system just goes offline to survive. It's like playing dead. It's being in the basement where your body is not reacting to anything. You might find yourself in the fawn response, where you're in the chronic sympathetic activation. That's in the attic. So if we think about this as a 3-story building, in the basement, we have shutdown. On the main floor, we have what we want as our active, aware, regulated self. in the attic, sympathetic activation. That could be disguised as helpfulness or hypervigilance, where your autonomic nervous system is stuck in threat scanning mode. You might find yourself emotionally numb because you've used dissociation as a protective adaptation because your nervous system was overwhelmed. So I want to give you some practical takeaways. And I want to also say that this is a skills and psychoeducational video, not therapy. But here are some things you can try. The first thing is name your state before you try to change it. So nervous system check-in, pause, ask yourself, where am I right now? And then scan for one of those three states. Am I activated and anxious in the attic? Am I shut down and numb in the basement? Or somewhere inside my window of tolerance? Naming the state itself is regulating. It helps to move you from your brainstem, from the trauma brain that I talk about, to the prefrontal cortex, where you can start to process what's happening. But you cannot think your way out of a state that you haven't acknowledged. So you want to acknowledge it first. The second thing you want to do is heart-focused breathing. And that's a HeartMath coherence practice. This is directly connected to the vagus nerve finding in the research that the vagus nerve is the brake on stress. So it stops your stress response. And we can tone it, the vagal nerve. You know that if the vagus nerve is tone, then it's going to be working the way we need it to. And you can do that through intentional heart-focused breathing. Here's how. If it feels comfortable to you, just place your hand on your heart and imagine your breath moving in and out through your heart center. So slowly in and then out. You want to breathe slower and more deeply than you typically do. And a helpful count is usually to breathe in for about 5 counts and out for about 5 counts, finding a rhythm that feels natural to you. HeartMath research shows that this kind of heart-focused breathing shifts heart rhythm patterns from chaotic stress patterns to coherent, where you can be calm and alert. And it does that measurably in real time. And you don't have to feel calm to do it. You just have to be willing to try. And it's important to realize that you need to practice it between triggers, not just while you are triggered. And remember that coherence is built over time with practice. This is one of the core tools we use in my 8-week HeartMath informed nervous system regulation group because it works. It's easy to do and it's evidence-based. The third thing I want you to try is a journaling reflection question about what happened. Here's the question. What did my body learn to do to keep me safe when I was young? And is it still running that same program today? I want to encourage you to write without editing. Let it be messy. This is not about getting an answer. It's about beginning to listen. And then if you want to, what does my body need right now that it didn't get then? I want to remind you that everything in this video is educational and nervous system skills. It's not therapy. It's not medical advice. And if this content is bringing up strong emotions, distressing memories, or physical responses, please slow down, use the breathing practice, and reach out to a trauma-informed therapist. Healing a dysregulated nervous system is possible, and it is best done with support. You deserve care that sees the whole picture, including your history. If you recognized yourself in this video, in the symptoms, in the story, you're not alone and you're not broken. I've created a free precision nervous system check-in quiz to help you identify which areas of your nervous system may be most dysregulated right now. The link's in the description below. And if you're ready for more structured support, I'm currently accepting applications for my 8-week HeartMath informed nervous system regulation group. It's designed specifically for adults healing from complex and childhood trauma who want practical, evidence-based tools to come home to their bodies. The link to the waitlist is in the description. If you're a trauma-informed therapist and you have clients who present with the kind of multi-system dysregulation that I described here and that's in the research, migraines, insomnia, emotional lability, digestive issues, and brain fog, my 8-week group may be a valuable adjunct to your work with them. I offer structured nervous system regulation skills using a HeartMath-informed framework as skills education, not therapy. You're welcome to refer appropriate clients, and I'd love to have you on my therapist resource list. The link is below to join. If this landed for you and you're recognizing your own nervous system in what I described today, don't stop here. I've created a free step-by-step video path so you're not left wondering what to watch next. It guides you through my entire trauma erase method system. If you're not ready for a whole list, the next video I recommend is called Triggered Again. Discover the 6 steps to calm and heal your reactions. In that one, I walk you through practical steps you can use the next time your trauma responses flare up. You'll see it right here on your screen and linked in the description. Tap that next and let me keep walking with you.